We have an amazing team here that I feel like I can provide the best care for my patient. And so that's what's special to me about our oculofacial plastic surgery service, is that I feel I have the power and the connections in the community to provide the best care for each individual patient. So when you come in for a cosmetic consultation with me, I first find out what your concerns are. For some people, it may be droopy eyelids and a droopy brow, and we can talk about the different options for that. One option could be a Botox brow lift to be more conservative and see how much lift if we just address the muscles that are pulling the brows down. And then for other people, surgery may be the right answer. And for others, it may be the under eye bags or the loss of volume in the cheek area. And so for those folks, the fillers are actually a really good option. So the most common orbital conditions that I see are thyroid eye disease, orbital tumors, and orbital fractures. So with thyroid eye disease, this is a condition that is associated with thyroid abnormalities like either hyperthyroid or hypothyroid. A percentage of those folks end up having thyroid eye disease, which can be bulging of the eyes, eyelid retraction, so the eyelids are open too much, dryness of the eye. For some, it can be quite severe and it affects the eye muscles, so you get double vision from it, and even compression of the optic nerve, which can lead to vision loss. What we like to do is catch people at the early part, and if we actually can medically decompress, the appropriate IV steroids or intravenous immunotherapy that we can offer as well, then we can hopefully get people before they reach that peak, or get the peak to be lower and have the disease resolve faster. So in the Thyroid Eye Disease Center that we have here, we collaborate with our rheumatology and endocrinology colleagues so that if there's a way to medically intervene in the early stages so that we can decrease the severity of disease, then we can make the disease a much gentler process. So the earlier you come in for your thyroid eye disease with us, the better it'll be, and then we can treat you faster with the right therapies.